How to deal with a child's fever naturally. Ibuprofen and acetaminophen are frequently used to treat fevers in children, but a small percentage of kids don't tolerate these medicines well or cannot take them for other reasons. If your child has a fever and an over-the-counter fever reducer is not an option, there are several other strategies you can try. Start by following basic fever reduction strategies. If your child's fever doesn't come down or if it's high, you can also try sponging them off with lukewarm water. As you monitor your child's fever, make sure to consider any other symptoms or special circumstances to determine if they might require medical attention. Keeping your child cool and comfortable. Encourage your child to drink water and other fluids to stay hydrated. Staying hydrated is important whenever someone has a fever, and fluids may also help to bring the fever down. Encourage your child to drink water or an electrolyte replacement solution, such as Pedialyte, to help keep them hydrated. Make your child comfortable and encourage them to rest. Being active raises your body temperature, so you might want to encourage your child to take it easy if they're running a fever. While it's not necessary to keep them in bed, try to keep them indoors and encourage them to play with something that will keep them seated and quiet, such as dolls or coloring. Place a cool washcloth on your child's forehead. This part of the body has blood vessels closer to the surface, so putting a cool, moist washcloth on your child's forehead might help to lower their temperature. Hold a washcloth under cool running water, and then wring it out. Fold the cloth in half and place it over your child's forehead. Change the cloth after it no longer feels cool and repeat as needed. Turn down the thermostat or run a fan if it's warm in your home. Lowering the temperature in your home may help to lower your child's temperature. However, be careful not to make it cold in your home, as this may lead to shivering and chills, which can increase your child's temperature. Instead, try to keep it comfortably cool, such as around 68 degrees Fahrenheit. Dress the child in light clothing and use light bedding. Having heavy clothing items on may increase your child's body temperature, so it's best to dress them in light, loose clothing that will allow the air to circulate around them. Get your child into a pair of lightweight pajamas or a t-shirt and shorts. You can also swap their usual heavy comforter for a lightweight one or even just a sheet. Sponging your child. Fill a bathtub with 1 to 2 in of tepid water. The water should feel lukewarm, which is about 85 to 90 degrees Fahrenheit. Don't use cold water, as this is likely to cause your child to shiver and get chilled, which can increase their body temperature even more. Undress your child and place them into the tub in a seated position. Don't lay your child in the tub. They need to stay seated while you sponge them. Kneel down next to the tub so it will be easier for you to reach your child. Use a sponge or washcloth to spread water over your child's body. Next, dip the washcloth or sponge into the water and then bring it up to your child's shoulder. Squeeze the water over your child's shoulder and let it run down their arm and trunk. Repeat on the opposite shoulder and squeeze water over the legs as well. Continue sponging until your child's temperature drops. It may take about 30 to 45 minutes to see a 1 to 2 degrees Fahrenheit difference in your child's temperature. Take your child's temperature after about 30 minutes to see if it has dropped. Then, take your child out of the tub, dry them off, and get them dressed again. When to seek medical attention. Call your doctor if your child reacts to any medications. Even medicine designed to treat fevers and colds in children can cause reactions in some children. If your child starts to exhibit symptoms of an allergic reaction or if they're experiencing serious side effects, call your doctor for medical advice. They may advise you to go to the emergency room or they may prescribe a different medication. Get medical attention if your child shows serious signs of dehydration. Mild symptoms of dehydration, such as being extra thirsty and dry mouth, are normal with a fever. But if your child starts to exhibit serious symptoms such as dizziness, decreased urine output or dark urine, and extreme sleepiness, then you need to get them medical treatment. Seek emergency medical help if your child's fever gets worse. A very high fever can be extremely dangerous, especially for children. If your child's fever gets too high, it can lead to serious medical issues and possibly death. Bring your child to an emergency room if their fever gets above 102 degrees Fahrenheit. Talk to your doctor if your child's fever lasts more than 72 hours. A fever should run its course naturally and go away after about 2 to 3 days. A fever that lasts longer than 3 days could be a sign of a more serious issue. Call your doctor if your child's fever persists past 3 days. They may want to assess or have you take your child to an emergency room. Contact your doctor if your child has a pre-existing condition. Even a low-grade fever can be harmful to children with certain conditions. If your child has a chronic medical problem such as lupus, cancer, or heart disease and they develop a fever, contact your doctor. They may want to take precautionary measures or monitor your child. Watch for symptoms that may indicate a problem. It's also important to consider any other symptoms that present along with a fever. Pay attention to anything you've noticed or that your child has complained about. Go to an emergency room if your child has severe symptoms. If your child has a fever along with other severe symptoms, this may indicate a medical emergency.